For those who are joining us for the first time, though, Medimag is South Africa's first digital medical lifestyle magazine, a space where healthcare professionals, medical students, and health-conscious individuals come together and explore intersections of medicine, lifestyle, innovation, and well-being. We started just a year ago as a small digital newsletter, believe it or not, an idea born out of passion for connecting the medical community in a fresh, engaging way. In just 12 months, though, we've grown from our humble beginnings into a respected platform delivering powerful content and building a vibrant network of readers, contributors, and thought leaders.
So Medimax and I share a similar sort of a passion, and that is giving out digital information to as many people as possible, especially in the medical community. And in South Africa, we are one of the now higher income countries. Previously, we've been a low to middle income country, but we're one of the countries where referrals, autonomously referrals are still an issue. So Medimax, or pairing with Medimax, essentially put us in a space where everybody or most people knows about who to get worried about and when to refer patients. And this will eliminate a whole lot of problems. And one of the issues which we may or may not get to later regarding rheumatic heart disease, referrals and early treatment is an issue. For patients to end up in my hands, it means they were not referred on time, or they were not treated on time, or they never sought health behavior or health care on time. So one of the reasons I had to be with you guys was I need to reach as many people as possible so that people don't get to die from preventable issues.
I think your values are in the right environment. And I think that's the key. I think that Medimax says that they want to spread factual medical information. They would engage with one area, maybe the medical fraternity. But if the public want to read and engage, they have an opportunity to read facts from factual individuals and from individuals that are well-versed and with clear accreditation. For us, why it was important for CHOC to engage with an organization such as yours is it allows us, just as we augment the medical fraternity with helping to reduce patient treatment abandonment, helping to support these families while they're treated by the medical fraternity. I think that what your magazine, what your members, what your leadership decided, and most importantly brought out your values, is to say that just as we augment in the medical fraternity within the hospitals under the auspices of the National Department of Health, so too do we have a place to join the journeys of communication, education, and knowledge. And most importantly, to be the voice of the patients and the families. Because as our survivors and as the community always says, nothing for us without us. So I think that it's the alignment of your values, your structures, and just as importantly, the knowledge that civil society, patient treatment groups, patient support groups can unite all for one mission and vision, and that's to see every family and patient have the opportunity to have the best treatment and, most importantly, comprehensive treatment.
I chose to collaborate with Medimag because we are aligned in values. So it was really a perfect platform for me. As I've already mentioned, I'm very passionate about health education, especially at community level. So the Medimag ZA actually gave me a platform to enhance my vision of empowering communities with accurate health information. But additionally, I felt it will be a platform where I'm able to also engage with the younger doctors as well, so as to help them with the knowledge. So basically, just the alignment in values made me agree to this task, to this job or task of being part of the Medimag team, because I saw an opportunity to be able to engage with diverse audience and always to be able to bridge the gap between us and the community, because that's the gap I identified, that since we sit at the lab, there's a big disconnect between us and some of the healthcare practitioner and the community as well.
We are always open to collaborate. And when you approached us and said, collaborate with us, we said, yes, that sounds like something we want to do. So what we do is that all of these events that we host, especially our own curated events, we have a videographer on board that records the sessions for us. And we've got CPD accreditation on all of our topics, and most of them are ethics topics. So that is always nice for the doctors to have, because I know you guys are always looking for ethics points. But we have gotten into this collaboration with Medimagza to provide some content, CPD accredited content, so that we can, if you need to up your CPD points, because we know it's a struggle, you've got an easy way to get it through Medimagza, where we've got quality recorded presentations that you can get CPD points on. And that's why we love collaborating with Medimagza. They give us some advertising, which we love always. But yes, we are there to provide a service to you as healthcare providers to get to stay with your CPD points. So yeah, that's why we love collaborating with Medimagza. And I think I love the vibrant colors and the way that the magazine is being put together. So Clive, well done on that. You've got a very beautiful magazine that's high-tech and easy to read and to work through. And yeah, that's why we love collaborating with you.
My speciality, emergency medicine, it changes so fast, and ultimately a platform where you can actually give insight on what emergency medicine is, resuscitation, the aspects of resuscitating a patient, but also looking at team dynamics, looking at caring for a patient in their dire. I think Medimagza provides a platform not only to talk about new possibilities in emergency medicine, but also to actually talk about, or write about, in this case, about how some things, even though at times when the patient maybe doesn't make it, even with all the efforts that you put in to save that patient's life, that you still get something from that. There's some degree of a lesson or life experience, even though it's quite sad, to get that life experience in such a way it actually uplifts you in the long run and makes you stronger to carry on, so that you can take the next step and look after the next patient and the next and the next, and still provide that dignity, that support, and the best possible outcome for your next patient.